Nasal polyps are non-cancerous growths that occur in the lining of the nasal passages or sinuses. They are typically benign and painless, but can cause symptoms such as difficulty breathing through the nose, reduced sense of smell or taste, and recurrent sinus infections. If left untreated, nasal polyps can lead to more severe complications, such as obstructive sleep apnea or asthma exacerbations. The exact cause of nasal polyps is not fully understood, but they are thought to develop as a result of chronic inflammation in the nasal passages or sinuses. Risk factors for developing nasal polyps include allergies, asthma, chronic sinusitis, and certain genetic conditions. While there is currently no cure for nasal polyps, there are several treatments available that can help alleviate symptoms and reduce the size of the polyps. Here are some of the most common treatments for nasal polyps. Steroid nasal sprays. Steroid nasal sprays are often the first-line treatment for nasal polyps. They work by reducing inflammation in the nasal passages, which can help shrink the polyps and improve symptoms such as congestion and runny nose. Examples of steroid nasal sprays include fluticasone, Flonase, and mometasone, Nasonex. Oral steroids. In more severe cases of nasal polyps, oral steroids may be prescribed to help reduce inflammation throughout the body. Oral steroids are typically used for a short period of time and can have side effects such as weight gain, mood changes, and increased risk of infection. Surgery. If nasal polyps do not respond to other treatments, surgery may be necessary to remove them. This procedure, known as a polypectomy, is typically performed under general anesthesia and involves using a small camera and instruments to remove the polyps. Surgery can be effective in reducing the size of the polyps and improving symptoms, but it is not a permanent solution and the polyps may recur over time. Allergy treatment. If allergies are contributing to the development of nasal polyps, allergy treatment may be recommended. This can include allergen immunotherapy, also known as allergy shots, which involves gradually exposing the body to small amounts of the allergen to build up immunity over time. Antibiotics. In cases where nasal polyps are associated with recurrent sinus infections, antibiotics may be prescribed to help clear up the infection and reduce inflammation in the nasal passages. In addition to these treatments, there are several lifestyle changes that can help manage symptoms and reduce the risk of developing nasal polyps. These include avoiding triggers that can worsen symptoms, such as cigarette smoke, pollution, and strong odors. Using a humidifier to help keep the nasal passages moist. Practicing good hygiene, such as washing hands frequently and avoiding close contact with people who have colds or other respiratory infections. Maintaining a healthy diet and exercise routine to help boost the immune system and reduce inflammation in the body. In conclusion, while there is no cure for nasal polyps, there are several treatments available that can help manage symptoms and reduce the size of the polyps. Steroid nasal sprays, oral steroids, surgery, allergy treatment, and antibiotics are all potential options, depending on the severity of the polyps and the underlying cause. By working closely with a healthcare provider and making lifestyle changes, people with nasal polyps can improve their quality of life and reduce the risk of complications.